Well, first of all, it's Heather McConnell speaking, and I'm terribly sorry for all of the challenges today. We have literally been on Zoom since early this morning and have had no difficulty. So I do apologize, but it may just be overworked today. Um, but welcome to the first Foot Care Nurse Forum. It's been an interesting time for all of us, and just really wanted to thank all of you for taking the time this afternoon to join this meeting. It became fairly obvious over the last couple of weeks, probably more so in the last few weeks than at the beginning of the response to the COVID pandemic, that we needed to address some questions, or at least provide a forum for those that are providing foot care to be able to talk and find a way in which we can get some ideas about what your key issues are. We may not be able to respond to all of your questions today, but we hope that we'll be able to take this time together to gather your questions, find some possibilities of ways in which we can help share the responses to those questions, and learn from each other. So looking forward to having the opportunity to be with you today. So Doris Grinspun, Chief Executive Officer of RNAO, will be joining us today. She's just on a Ministry of Health call right now, urgent call. They called her unfortunately, just before we got on this call. So she does intend to be with us today. Myself, Heather McConnell, I'm the Associate Director for Guideline Implementation and Knowledge Transfer at the RNAO. You've heard from Bev Faubert, Long-Term Care Best Practice Coordinator, who's joining me here today. And Catherine Jewell, the Nursing Policy Analyst. Catherine, are you on the call? I'm not sure if she's been able to get on yet or not. Okay, maybe not.
Hi, sorry, Heather. I'm on the call. Can you hear me?
Yes, we can. Thank you. That's perfect. Excellent. So Catherine is a nursing policy analyst. And so we thought we'd bring together this group of individuals, again, from both a clinical practice and a policy perspective, as we have opportunities to discuss some of the questions that you have, and maybe some of the challenges that you're experiencing, some of the opportunities that are out there related to a foot care nursing practice. And I do have to say that we were overwhelmed with the number of people that registered for this particular meeting today. We have almost 200 individuals on the call right now, and had over 200 that had actually registered. So, you know, as much as we knew that we were getting questions from nurses that provide foot care services via email and through our website, etc., really we're anticipating this many people that were interested in needing some support in this particular area of specialty practice. So I'm just going to take this opportunity to, again, thank you for being here with us today. And we have PG Batten on the line as well as Melissa Aziz, who have been helping us get everybody on the line. So thank you to the both of you for making this possible today. So I did just want to remind everybody that there are a number of resources available that RNAO has been working on over the past, well, almost 3 months now. Maybe it is 3 months now, moving into our fourth, since we've been working on very specifically COVID-related resources for nurses and other healthcare professionals. So I just want to remind you that the COVID portal is a place you can go to get updates and information about the latest policy directives from the government, resources and tools to help you make decisions about your practice in terms of infection prevention and control resources. As I said, directives from government, those change very frequently. And so through Doris's blog, you'll be able to capture those most recent ones and updates from the Emergency Operations Center. We've also got our COVID press room, which includes posts about our press releases and activity in the media. Our COVID-19 webinars, and I don't know, maybe people could put in the chat just whether or not they've actually been able to attend any of those Monday night webinars. It'll give us a bit of a sense of how people are utilizing those webinars to help support. So just let us know if that's something that you've been able to join in with. It'll give us a sense of how you've been working with. You've got some raised hands here, so that's super. Thank you. And then, of course, we've got Doris's blog that continues to be posted on her 3-time-a-week updates. and PG that's on the call now is the one that helps her send that out to all of the members and beyond to be able to help provide updates about the work that's being done. We're just getting feedback here in the chat about absolutely webinars are excellent and awesome. So that's super. And again, we're really trying to find different ways to support the healthcare professionals, particularly nurses, of course, NPs and nursing students, but basically really wanting to find ways to help support the different ranges of individuals. So some of the tools that you've seen on their blog would be very relevant to you. We also have some COVID-19 webinars that, again, that they're available for your use, and they've been recorded and posted there for you to follow up on. We also have a number of resources specific to long-term care and retirement homes, and some of these resources and tools have been created by our long-term care best practices team, but also many feedback and ideas that we've received have come from our regular meetings with nurse practitioners in long-term care. We've been meeting with the NPs, Bev, how long would you say now? A couple of months, maybe, I think. And at first those were 2 times a week. And now we've decreased those frequency down to once a week. But many of the ideas for our webinars, for our policy directions, for our tools that we've developed have come directly from those meetings. And we're hoping that maybe what we can see is that the call that we'll have today can help inform our work in helping us support you. So I just want to put that in a little bit of perspective. And then, of course, we've also got on this website the situation reports, which again are the daily situation reports that come from the MOH. And that's probably a place that you'll want to really pay attention to because that provides you with all kinds of resources related to and updates related to the status of the various different aspects of our work and the work of the government in terms of opening up the province. So at this point, I just did want to say that the intention of this time together today is to was to basically kind of check the pulse, see what kinds of questions you were dealing with, what kinds of challenges or ideas that you were thinking about. Some of you seem to have been doing some of your work in foot care services, and many of you have not been. We have a wide variety of individuals in terms of the kinds of practice that you're working in terms of the questions that we got in advance. We saw that we had nurses that were in private practice, either doing home visits or visits in retirement homes or long-term care homes prior to the pandemic. Some of you have home-based businesses where clients come into your homes. Some of you are working in foot care clinics themselves that are providing foot care clinics in various communities, faith communities, etc. So a huge variety of types of work that you're doing in terms of the structure of the work that you're doing, and which I think is reflective of some of the questions that you may have. So I'm going to just stop there for a second, and Bev and Catherine, did either one of you want to add anything to that before we move on to doing a bit of checking the pulse and looking at some of the questions that we received, and then we can look in the chat to see what kinds of comments people have made. But I'll just be quiet for a moment and see if you've got any comments you'd like to make.
Thanks, Heather. I think you did a great overview, and I don't have anything to add now from my end. Thank you.
And it's Beth, and I don't see anything in the chat box. I'm just, there's just one comment about ensuring that we call the treatment of provided by foot care nurses a treatment and not a service. So.
Oh, okay. I beg your pardon. Very good. That's good for me to know. Thank you. I will make sure that I try and remember to say that today and certainly in the future when we're talking and writing about this work. So thank you for that. Okay, and I'm just checking to see PG or Melissa. Is Doris joined us yet?
I don't see that Doris has joined the meeting yet, no.
All right, well then let's move on then. And if you've got questions, I should say, please put them in the chat box. We'll be monitoring, Catherine, and Bev will be keeping an eye on the chat box. And I would really hope that we can take this time together to share some of the ideas and strategies that you've been thinking about. We've pulled together some of the questions that have come in advance of this meeting. And I don't, we wanted to have this call just to get a sense of what your needs were and whether or not this was something that we might want to do on a regular basis to be able to support you in your work. And I suspect that we may want to have some follow-up sessions after this. So this is really a bit exploratory for us to get a sense of your needs and also to see if we can answer any of these questions initially. But I'll be quite honest and say that we may not have the answers for everything. So we'll try and respond as best we can. But by all means, if those of you that have been kind of working your way through this have some thoughts, suggestions, or ideas that you'd like to share, please do so in the chat box. We'll make sure that we try and address those throughout our time together today. And what I'd like to suggest that we'll do is we'll gather these questions that we may not be able to respond to and do a little bit of homework and be able to bring the questions and answers back to you. And I'm hoping that that's all right, because we're just trying to get a sense of your needs. And if there's things and people saying that they would love regular meetings, that's super. Yeah, we'll have to kind of talk a little bit about that towards the end. So I'm going to just say that there's been a range of questions, and I think that they kind of are summarized in a few key areas. So there's been many questions, and some are kind of similar. And so when we look at the questions and Bev, I'd be happy, because you looked at the questions as well. So if I'm not capturing the questions that were submitted prior to the meeting accurately, please don't hesitate to jump in, okay?
Okay.
Yeah. So they came into kind of two main categories, sort of opening up foot care practices, and then some more really specific questions related to infection prevention and control. And so we've had questions about, can I work at more than one organization if they are not long-term care homes? So this again is coming from people that have had, they're not necessarily working in a long-term care home, but they might be working for a home health care agency and also have a private practice where their second job would be actually, they would be self-employed, and that would be their second area of practice. And so I think it's really important to start thinking about this in terms of what the requirements are from the government, and also as things start to open up, because you can see that they're starting to talk about, well, I've already started to talk about dental services, chiropractics, physiotherapy, etc. And again, really thinking about when you're looking at those types of services, how does that relate to the type of practice that you do? And where you do your practice, because I think that's going to be the most critical thing that all of you, and you particularly related to the type of work that you do, it'll be dependent on the environment in which you provide those services, foot care treatments. So I'm not sure that I can just answer that question outright. It's really dependent on whether or not, right now, long-term care homes, as you know, individuals are restricted, and essential visitors are restricted. Our visitors are restricted, and essential services, there's limitations. So I think it will be really dependent on where you're actually practicing, whether you're practicing in a foot care clinic where clients come to you versus whether or not you're actually providing services in multiple formats in different organizations and in your own practice. We had questions about determining urgent and how to determine whether care was urgent or not. And I think this is again in relationship to the need for some definition around whether or not it's appropriate for you to actually be providing some of these services right now. And of course, we had this question brought forward to our speaker on Monday evening, who was a physician from infection control physician from Michael Garron Hospital, who spoke eloquently about infection prevention and control. And we talked about, the urgent nature and the essential nature of foot care treatment and care, assessment and care, and being able to determine when in fact a treatment is urgent. And one of the individuals that wrote this particular question was wondering about getting an order from an MD or an NP to ensure the care is required and within the scope of practice. And this, I think, would be in a case where there had not necessarily done an assessment of this individual previously, that it was somebody that they hadn't provided care to, and were really concerned about being able to make a decision about whether or not it would be considered urgent care when they hadn't actually provided done an assessment on those individuals. So there are just hundreds of things coming in the chat room. So I can see that many people are, this is going to be hard to keep up with.
I know. Heather, can I just offer a suggestion to the group?
Yeah, please, yeah.
So I want everybody to know that it took all the questions that were sent in ahead of time, and I really researched all of the possible organizations, regulations affiliated with anything that has to do with foot care. So chiropody, podiatrists, you know, I went to the Ontario Podortho Nursing Association. I have condensed, I've taken the questions and I've tried to align the resources and the information as much as possible. I'm going to preface this with saying things are changing so fast. As of, you know, 2 days ago when I started this, it's different today. So I'm just offering, Heather, to the group to send that out to all of you who have joined this today, and feel free to look it over and edit and you know, read and see if it helps you, or if you need more explanations. As I'm saying, you know, we're not the foot care experts, but I certainly had, you know, the ability to take time to try and answer your questions the best I could. I guess that's the best way of saying it. So if you look at, I've included a lot of links, and there is a lot of information to all the questions you're looking for already out there. And there is not a whole lot on public health about foot care nurses, but things like foot care clinics, when I looked yesterday, they're still closed in the province. But today on the news, they were talking about how dentists and chiropractors and massage therapists can open their offices, but they still need to use the PPE screening, or I mean the COVID screening tool. They still need to have PPEs available. They must use social distancing. They must wipe down all their surfaces. But at the end of having said all that, the comment was made that we have to identify there's still a risk. And even though, you know, you might be doing everything, you still could be at risk or putting people you're caring for at risk. So if you want to look at this time, what I'm finding in most of the regulated bodies, information, public health, we have to be able to differentiate urgent from non-urgent. And there's a really good guide on that Podortho Nursing Association, I hope I'm saying that right, that tells you exactly what you need to do. So when you, I see there's some chat. The chiropodists, if you go to their college site, they're actually saying they're only open for emergency or urgent, and if anybody has a foot care issue, to notify their doctor. So that's what I'm finding on the website. I'm sure there's all kinds of variances in the province, but I will share that with everybody, and then if we meet again, we can talk about, you know, how things have developed. I don't know if that helps a little bit with the questions we're having, Heather.
Yeah, no, that's fabulous, Bev. Thanks very much. You know, Bev has done a lot of work in kind of trying to assess some of the questions that we got in ahead of time. So we actually have all of those links in a Word document that we will PDF and send out to you after this meeting. Again, with all of the links and resources that she's been able to find. There's a lot of people in the chat that's providing some comments, which is super. And again, I think what we'll need to recognize is that there's no easy answers to all of these things. Much of it is really thinking through the process of what is the directive from the ministry, you know, what is my type of practice, and then being able to make some of those clear evidence-based decisions related to this. So I think we've got some good comments in the chat here in terms of responses to questions from each other. So great to see that. Again, I think looking at, can I provide care in more than one home? So this is for home visits. And I'm not sure how many of you are in those particular circumstances. Oh, if you can't see the comments, just click on chat. You should be able to open up the chat box and see all of the emails that are coming through here. And they're not emails, they're chat comments that are coming in through here as we're talking. So again, some really good suggestions around chiropodists and chiropodists, etc., that are open right now. Certainly in terms of working for more than one employer, and I think they kind of linked that back up to the question that was up at the top, was can I work at more than one organization if they're not long-term care homes? And then should I have clients sign a waiver for consent re-COVID? And I've seen a number of comments in the chat related to consent and whether verbal consent to have foot care services done, first of all. And then I think in the context of this question, it was related to thinking about the risk for the individual related to COVID. So lots of questions about that, and I could see lots of responses from individuals in the chat box. What I think we'll do is we'll copy the chat box at the end of the meeting. We'll pull some of the questions and then take some of the comments and try and line them up. We can again share those with you. Actually, I'm going to ask a question, and I'd appreciate some comments in the chat box. Would it be helpful if we found a spot on our COVID portal to post this particular meeting recording and also the questions and resources that we're pulling to answer some of your questions, because it might be helpful to have them in one place. Yeah, it's got a few people with their hands raised and people posting, yes, please, post, yes, please, sure, absolutely, please, yes. Okay, we'll take care of that for sure. Oh, people are waving their hands too. That's exciting. Okay, so we'll absolutely do that. I'm going to move on and just show you some of the other questions that we got. And then what I'd like to do is maybe I'll ask Bev and Catherine to kind of capture some of the questions that are coming into the chat that maybe aren't the ones that are reflected on the screen or that we'll look at next. And we can use these to kind of guide our preparation for the next meeting, because it looks to me as if there's a need and an interest based on what your response was to my initial comments. And then we'll look to see, who might best be able to have available to join us for one of these calls to provide some guidance. And I'm thinking in terms of having, an infection control practitioner, for example, with an understanding of the specialty nature of your work, might be able to have come and join us and respond to some of your questions, because they're very specific. Okay, so I'm going to move on to the next slide there. And again, a lot of questions around infection prevention and control and what kind of screening of clients, home visits and home clinics. And I've seen a number of comments in the chat here about the screening as well. Certainly, screening would be expected for you to be doing, self-screening every day, but also any of your staff that you might work with, etc. So that would be expected, I think, before you would even start your work. And then, of course, being able to do a screen of clients, whether that's on the phone, prior to visits, etc. And I see there's a lot of comments here.
The other thing too, Heather, I'd like to add here is, and when I was
please,
doing the resources, they were also saying that you need to ask questions about any vulnerable people in the home. So it isn't just about the specific people you're treating, and I'm assuming this is for community. Well, it could be in long-term care homes too. So even though you might be seeing a non-COVID resident, say in long-term care, or a non-COVID client in the community, you need to ask if, is there people in there who are living, with immune compromise, for example, or small children, and then really, determine, are you putting anybody else who's in that area or in that home at risk by you coming in to do foot care. So I think there was a lot of discussion about that, or a lot of information about that as well before they start going in to provide home or foot care.
Yeah. Mm-hmm. Good. And I can see comments about we need to very much use our knowledge, skill, and judgment to do assessments before we get started. It looks like a little post here that says Ottawa's started to open up foot care practices just this week. Okay, so that's an important piece. The whole component around equipment, movement between clients. This was a specific question, about do I need to cover my, and how do I carry my equipment from home to home, I guess, and being able to disinfect it appropriately in between times. And Bev, I'm not sure if there was anything really specific about.
Yes, there was.
Yeah, good, okay.
And it was a huge document, but it's also included, the links included on the list of resources that relate to all these questions. And it was from, I have everything here. It's a COVID-19 checklist for infection and control checklist for long-term care and retirement homes if you're going there. But there's also, IABPG has a document that says practice recommendations for infection prevention and control related to foot care in healthcare settings. settings. So there's two huge documents that talk about transportation of your equipment and cleaning of equipment, and that's included in that resource page I developed.
Okay, super. Thanks, Bev. And Rami, I believe, has just referenced that particular IPAC document from IPAC Canada, provides good information for practice in nursing foot care. So that's great. And again, I think the practices that you would normally be taking would be continue, and then thinking about what additional requirements might be necessary for this particular situation right now, and into the future. So lots of questions about PPE, and I can see in the chat there's been lots about that. It looks like some people are having a challenge actually accessing PPE, but there's a lot of comments here around where you can get it, how much it costs, different places you can order. So that's really helpful for others. I realize that if you're a solo practitioner, maybe you may not have the supply chain that others have. So it's been important to think about. So thank you for sharing those resources, everybody. That's really important. And again,
Heather, this is the most exciting webinar.
Well, I don't know how exciting it is, but no, the volume of activity in the chat is phenomenal. And there's clearly a need. So this is good. So we just really weren't sure what to expect and what kinds of questions you might have, but we can see them coming through in the chat. So I'm going to just finish this slide up, and then I'm going to turn it over to Catherine and Bev, just to see if we can kind of capture some of the other questions that might be coming forward, and some of the responses from the people on the call. Again, we'll use this information to kind of pull together a little package of question and answers, and if we can't answer them, we'll try and find out who can help us answer them. And then we can maybe look to see, what I'd like to do is, before we wrap up, I'd like to make sure that we have a bit of a plan for what your needs are into the go forward, and what kind of resources or opportunities you might like to have in terms of talking in the future. Okay, so that's great. Lots of thanks in the chat box as well. Now, somebody asked about, should I be tested before I start practicing again? And there's a number of comments in the chat about regular testing, not only for yourself but other colleagues. I mean, I think it depends obviously on your unique situations, but I think that you need to be thinking about your own, protecting yourself, but also obviously protecting your clients. And depending on whether or not those clients are in long-term care, I would think that you would need to be tested before you go into a long-term care home to provide services. But I'm just seeing that they said here that public health said that you do not have to be tested before you go back to work. That was from public health. So it depends. I think it depends on where you're going into, but certainly, what did you find out in your literature?
I just want to add that there's nothing in the literature,
yeah.
But what I did want to say is that it's regionally there's variances. So where I live in southwestern Ontario, they are really encouraging, and not enforcing, but encouraging everybody to get tested. So I don't see where it would be hurtful if you got tested, because there is asymptomatic, and if you're going from home to home, it would be a great way to manage risk, right? Because I think the one thing we have to think of when we're providing foot care, regardless of the setting, is there is a huge risk with this virus. So we need to be able to manage the risk. So in the area where I'm at, it's very, very easy to get tested, and they really want everybody living in this area to get tested. So look at where your region you're in and see what they're encouraging there, because there are variances across the province on that.
Yeah. And I think all ongoingly symptom monitoring and self-screening will be important. And we've got lots of people here on the chat talking about wanting to be able to connect with each other after this. Unfortunately, we did not ask for permission to share your details. So if there's somebody in particular that you'd like to speak to again, that's on this webinar right now, you can message them privately. I'll just pick their name off the list when you go into the chat. Rather, right now that everything's going to all panelists, but attendees. But you can certainly choose to have it go to an individual, and they can provide your contact information if they feel comfortable following up with you in the future. So I just wanted to acknowledge that. Okay, so
You know what else I
see.
wanted to add, Heather? Sorry.
Yeah, no, go ahead.
To cut you off. I know there was some comments, and I noticed are coming up in the chat box as well about being deemed essential and non-essential. And when we joined that webinar with Dr. Jeff Powis, is that his name? He did have a discussion with Doris, who is our CEO at RNAO, about, how do I want to say that, Heather, about moving something forward about, you know, having foot care nurses be deemed essential for residents and clients who are going to be facing adverse or serious health outcomes if they don't get foot care. So that is something Doris has on our radar, is what I wanted to say.
Yeah. Okay, so my goodness, we've got orders for PPE going on here. Hi, Gloria, nice to see your name. Lots of chat here. So I'm going to just move along then, and what we wanted to do was just sort of check the pulse. So I think, actually, I'm going to come back. Sorry, I just moved too quickly on my slide deck here.
Well, while you're doing that, Heather, I'm going to add something.
Yeah.
I just want to say that when we're, you know, I did call long-term care homes in my area just to get up the pulse on what their position was for foot care and long-term care homes. So I think we have to, you know, agree they're opening up slowly. And when we're getting questions about, you know, can I go to more than one home, or can I see more than one resident? Every single long-term care home is managing who they're letting in and how many residents they can see differently. But I think in preparing to go into long-term care homes, I would suggest in retirement homes as well, you know, have a conversation with that administrator. Now in our home, in this area, they're letting one foot care nurse in only if she's going to one home. So how many residents she can see in that home at a time, I'm not sure. I didn't ask that question, but I know right now a lot of the homes are really being careful, and so they don't want people coming into their long-term care homes if they're going into more than one place.
Yeah. We've got lots of chat going. Oh, hi, Doris. How are you? Welcome.
It says that the host does not allow me to put the video.
Well, we'll have to have, I can't do anything about that, I don't think.
Who's the host? Who is the host?
Well, I was just going to say it'll either be PG or Melissa, but if you'd like to share a video, that's fine.
I just want to say hi to people because I need to leave in like 15 minutes max.
Yeah, no, that's okay. We've got about almost 194 people on the line right now, Doris. We can't keep up with the chat box. There's so many questions and comments and people helping each other with finding PPE, et cetera. So let's turn it over to you, because I know you want to say a few words, and then
yeah, is it possible, Melissa, to put the video? I love to see the people, or we are not seeing.
You know what? No, you know what, Doris? We're on a webinar because of the number of people, so sort of like we are on Monday night. Yeah, we can't.
No,
exactly.
Yeah,
unfortunately.
So I want to first of all say to people, this is what happens when you ask something to RNAO staff. Okay, that's number one. A few of you wrote to me in response to the blog, and look what Heather organized, a whole thing where you guys, and we never, honestly, when Heather told me that we had 200 people, I was amazed because we didn't expect this. And so what we will do after we end the conversation later on today or tomorrow, Heather and I will see if she has been able to identify that we need actually once a week or once every 2 weeks until you guys get going with the response. But I know one thing, Heather, that people very much wanted is if we could develop some type of policy. I asked the ministry today if they could develop something general for all the independent practitioners in relationship to how to start and when to start. And the answer was the regulatory bodies will do some of that. I don't know if our regulatory body will start to direct every independent practitioner. My hunch, if I was them, I would say point of care nurses, you need to assess that you're safe, that you have the PPE, etc., etc. Certainly the College of Nurses will not tell you where to get PPE, but Heather, when we were at the beginning of this crisis, I sent you guys, and I can also ask it again if you cannot locate. There was a point when they gave us a link to where people can order PPE. That is not it's not the government one for the essential services that they have.
Yeah.
That is for everybody else. If you cannot locate it tomorrow or someone of your staff, I will ask. You know what? It will take me nothing to ask for it again if you prefer.
Sure, that would be fabulous, Doris. Thank you.
I will. Now, that doesn't mean that people will have an easier time that if you use your usual supplier. My view, my first thing is I go to my usual supplier. I go parallel to the usual supplier and to this link that we will send you, and we will send it to you tomorrow for sure. So that's one thing I wanted to say to people because that came through the emails, very much so. The other thing I wanted to say is that what this has done to nursing and to the group of nurses that work specifically on food care, whether it is for people with diabetes or for other people that need that, older persons, etc., it has raised the profile big time. And I want to share with you, and you can see it for yourself in the video that we did on Monday, this past Monday, with Dr. Jeff Powey, who is the Director of Infection Control at Michael Garron. I posed a question to him about food care nurses and their work, and I said, I know some may think it's frivolous, but hey, I want to give you the example of a nurse that because she cannot do that, the client hurt his toes and was bleeding. And this is one of you that wrote to me about that. And he gave really remarkable remarks that you will all feel very proud of how he values the work of nurses that dedicate themselves to food care. So I wanted to share that, and maybe someone in your team, Heather, can send that link to that video.
Yeah.
And at the end of the day, what we are interested from RNAO is to help you on areas where we can do collective work. So we facilitate basically your practice. So I don't know what has come common, Heather, because unfortunately,
No, it's fine, Doris. I think the questions are coming fast and furious. In fact, there's so many of them that we can't even get through them all. But I think what the questions that came in advance were really kind of categorized as and I've got them up here on the screen right now, which we just finished going through, is opening up foot care practice. So trying to think about what do I need to do to get myself back when we're able to, what do I need to be thinking about? And we've had some good dialogue through the chat and suggestions from the team about those on the call about some of these questions. And of course, infection prevention and control.
I wondered on that one, Heather, if there is a value of one of our LTC coordinators connecting with 3-4 people that volunteer here, but 3-4 people that work in different venues, like one if it's a food care clinic, and one that is in a nursing home, and one that goes to home of people, or people go to their home, and try to do something, what is common that we could help. And then run it by, I doubt, Heather, that the college will really look into that very much. I may be wrong.
Heather, Doris, I looked at, it's Bev, sorry. I looked at the College of Nurses yesterday, and they have a COVID section, but it's talking about being accountable and
I know. That's
following the emergency order.
That's why I am saying I doubt it will give specifics. But what we could do, Heather, is after we have something together, we can see what the chiropathists say, right? Through Miriam, and put it together.
Yeah. Well, I've got a couple of volunteers already here, so that's super.
Fantastic. Fantastic. What other issues have been in common? Because that's, I know, an urgent one.
Yeah, I think some of the issues around the whole issue, many of our foot care nurses work in different kinds of settings. So they work in long-term care. They also work in their own clinic. They work in do home visits. So they're just really struggling with this you know, should I be doing more than one place? Would I only pick one location to provide my services, etc.? Right now, because they are having more than one, they might be one of their own employers.
That's a very good question. My
Mhm.
suggestion is, that's a very good question. That's a good question. You see, if it's going to people's home, it's like home care nurses, and they're doing visits. So if it was
Yep.
me that I work in home care independently, I would start, you know what I mean? Except that the government didn't include you in the so-called essential services, which we are tackling. And I don't think the college will prohibit that. But if it is different employers, I think you should ask your employers. I really do. I think this is something that they will be dealing with other things like physio and etc. So I think the best answer for that is ask your employer, because probably it changes from employer to employer.
Yeah, I think it probably does. And in some cases, many on the call right now are their own employers. So yeah. Yeah, okay. And listen, I've got about numerous names here, people that have indicated they'd be interested in working on something together. So
Can I propose something with that, Heather?
Yeah, please do.
I suggest that you just handpick 5, 6, 10
Yep.
max
Yep.
That work in different settings.
Yep.
And that then you work with an LTC to coordinate that, and that then you bring it back, whether in a week, because the opening is kind of urgent. Bring it back, we do a second webinar, and you bring it back to the entire group.
Okay.
So no one feels left out and the others are involved too.
Yep, super, yep. Okay, and the comments are flying in here. So what I'm gonna do is we'll copy the chat box here so that we can kind of summarize some of these things for our next time together. Bev, you were gonna ask something.
Sorry, Heather. I just wanted to summarize too. I'm watching the chat box and there's a lot of questions about PPE and masks, and Doris's video that she's suggesting everybody watch will answer a lot of the questions about masks and shields. And
it is in the blog this last week, and it is the video of Jeff that did quite frankly an experiment, and it's amazing. It's amazing.
Oh yeah, the one on the masking. Yeah. We'll send out those as part of the package after the meeting. We've got some resources to send that we've collected, and we'll also send the links to Monday night's video in case people didn't get a chance to see it. And also the mask video, because that's really a dramatic demonstration of how to put them on and off, and doffing and donning, and also the potential for self-inoculation.
You know, I like this question here, should I be having the client sign a waiver for?
Yeah.
I think it's not a bad idea at all, although you must come with your mask anyway. You know what I mean? That doesn't, because the person can sign a waiver, but you still are a professional.
Yeah.
Right? So I'm not, you know what I mean? The fact that they let you in their house, that's kind of the waiver. But you're it's equally important when they come to you, right? Now, you don't aerolize anything with them. Like, you're taking care of your feet. So to me, you know, unless the person is coughing, and then you shouldn't see them, quite frankly. But if the person is not coughing, a surgical mask is what you need.
Yeah. Okay, so anything from the chat that you think we might be able to address, Catherine or Bev, while we're here right now? We've only got about 3 minutes left.
I don't have anything else to add.
Okay, and Catherine, what about any questions that you think we might be able to respond to?
Thanks, Heather. I was just I was going through some of the questions. I think probably the best approach will be for us to analyze and group into themes a lot of the questions that came through, so that we can address any similar questions together in a follow-up, if that's possible, just because there are a lot and they're not currently grouped in the chat right now. So I think if we take some time to go through, then we can come back with some thoughtful answers, if that's okay.
Yeah, okay. That's fine. I'm just looking to see if there's anything else. And somebody's made a comment about the liability insurer will guide you. I think that's in relationship to the having clients sign a waiver. So there's a huge number.
The liability insurance may or may not.
Yeah.
May or may not. I know that ours covers COVID. I also know that some others don't cover COVID already. So I wouldn't put my eggs on that basket. I will put, you know, insurance will find a way many times.
Yeah.
I think your eggs in the basket is that you have your surgical mask, that you are providing even the client with the surgical mask and all the rest of it.
Yeah. Very good. Okay, so I think at this point then it's about, we've got about 4 minutes left. So maybe what we'll do is just sort of summarize what we've talked about here in terms of what the next steps might be. So I think where we were talking initially, Doris, before you joined us, was that we would, you know, get a sense based on the interest from this call today, you know, whether or not we should do this again. And there was clear consensus that we should. Yes, please, yes, please, yes, please, absolutely. So that's super. I think what I would suggest, but based on what you're recommending, Doris, is that if we looking at you know, some direction regarding policy and being able to gather with some of these individuals that have volunteered, we'll need to you know, a day or two to kind of get together to do some of that work. But maybe we could meet again either late next week or early again the following week.
No, I would do Heather
week?
Next week. I tell you why, Heather.
Yeah.
I think that the need of clients is real. And I think the sooner we can help people, even if it's with a sketch of what opening will look like,
yeah,
and bring it to the group. I think that this group will not need more than one or two more meetings. Like, this is not forever, but I think the urgency is now,
yeah,
so that we can get them off on their feet. Also our colleagues and also the clients.
yeah.
And also remember, it's also partially a business, and all the independent providers, whether it's dental hygienists or whether it's massage therapists or whether it's our colleagues that do food care, are all suffering really big time.
Yeah, no, I understand. Yeah, okay. Well, absolutely. Then we'll be in touch. We'll have a look at the list of those that have offered to be of assistance with that work. And again, we'll be looking to see, and many of you, you've all indicated sort of where your practice specialty is, or at least the sector that you're working in. So that's helpful. And we'll have a look tomorrow and be in touch to get started on this work. And we'll make an arrangement to meet again next week. We'll have a look at schedules to make sure that we are hopefully able to get as many people on as possible. But the numbers today were outstanding. The comments in the chat box have been highly supportive of each other. So I want to really thank you for all of your comments and your support of each other. And we'll reconvene next week. For those of you that may not be able to join us next week, we will record the session so that you can hear it. And we will also, as I said at the beginning, post this particular meeting along with the resources that Bev has collected on our website so that you can access them. And we will certainly send them out to those that are on the call right now. So with that, I'm going to wrap it up. Doris, did you want to make any final comments?
No, I just want, first of all, to say thanks to you, Heather, and to the colleagues in your department and in policy for organizing this. First of all, I want to say thank you to the ones that raised questions, because, you know, it would not have occurred to us, guys. It would not have occurred. So to the 4 that raised the questions, take credit for that. To Heather and her team, and to Catherine and policy, etc. Thank you for organizing it. And I know that this protocol will help not only them, Heather, it actually will all probably help other independent providers on other areas. And we may share it after, like massage therapists, etc.
Yeah.
So that's a conversation that you may want to have with some of these other colleges, not colleges, associations that are smaller, and tell them what we are doing, because they may have something that may help us.
Yeah.
I can send the question. I had a meeting with all of them. I can send the question, and if maybe they will send, and then I can take care of that if that helps.
That would be fabulous. Thank you. Yeah.
Very good. And I think after that, I don't foresee a lot of areas after, but this is giving us as also an opportunity to learn of your work. So thanks to all of you.
Heather,
Yes.
we just have one more thing before everybody leaves. There's questions in there about where they can find these resources. So I've just put in the chat box that they will be posted on the RNAO COVID portal site, and we will email probably. And some people were asking if Monday nights are the best night, or you want to talk about, are we going to have these?
We already have Monday. We already have Monday night, right? Don't we have Monday night, the general one?
Yeah, Monday night's the general one, and it's getting hundreds of people on each night. So I think that's a good night for that session.
Ah, okay, sorry. Excellent.
Yeah.
Okay, thank you. That's my other call. Sorry, guys.
Yeah, I hear it.
Thank
Not to
you
worry.
so much. Bye-bye.
Okay, thanks for joining us, Doris.
Thank
Okay.
you. Bye-bye.
So with that, I'm going to thank you all for joining us. The response in the chat, I'm telling you, has been overwhelming. So I'm delighted to see the conversation going on and the support that you're giving to each other. And again, so I think we've got some next steps to take. So we'll be in touch either very shortly for those of you that expressed interest in working on this, and otherwise we'll be sending out a list to those that are registered for this session. We'll send out to all of you the link for the next session. And again, if you're not able to come, we'll archive it and make it available. So with that, I'd like to thank all of you for joining us. Thanks to Catherine and Bev, and to PG and Melissa for your help today. And I do apologize for the trouble at the beginning, but hopefully we can move forward in a very positive way. So thanks very much, everybody. Have a good afternoon. Bye for now.